Li-Fraumeni syndrome was described by Lee and Fraumeni, and the gene responsible is TP53. Mutation, pathogenic variant are responsible for Li-Fraumeni syndrome. So the key message in Li-Fraumeni is the huge phenotypic variability, clinical variability between individuals, between patients, within a family, and between different families. And one patient with one dedicated mutation may have one type of phenotype, and another patient in another family with the same mutation, the exact same mutation, may have a different phenotype. And within a family where this mutation segregates, you may have very different phenotypic manifestation, such as brain tumor, breast cancer, early onset breast cancer, but you may also have within the family unaffected people. And what drives this heterogeneity is really part of mystery. Again, we have some clues, we have some research, but from a genetic and medical point of view, this is really a case-by-case analysis and counseling. The difficulty is that we found TP53 mutation very outside the frame, the classic Li-Fraumeni core spectrum. And it means that we have major difficulty in terms of genetic counseling. Should we consider, for example, if a lady develops breast cancer, let's say, at age 50, with a familial history, obviously, otherwise it's not an indication, but should we consider that there is, for example, a pediatric risk? And we perfectly know that it's not because one mutation has been observed with pediatric cases in the family that it means that you will mandatorily have a pediatric case in the family you're taking care of. Because we all know in genetics that the mutation by itself is a driving force of tumorigenesis, obviously, but the environment and there is a genetic background running in the family that also have an important role on the phenotypic aspect. And assessing this genotypic background is very difficult. So it's always, for example, in other predisposition to cancer, such as breast cancer, this genetic background is evaluated to calculate the tumor risk in women affected with bearing BRCA mutation. But in Li-Fraumeni, we know that it exists, it plays a role, but we are not able to really weigh the importance of this genetic background. And we are not able to say, okay, we have a protected background, so there is no need to test the children in this family. We do not need to monitor the children in this family. So it's always, we have to weigh between the familial history and what is reported in databases, in the literature. The idea really is to identify the proper determinants, to go to this precision medicine, to give the exact care patient needed. That's really the way forward. This is the future of Li-Fraumeni and oncogenetics as a whole.